Hello, my name is Clark-Reyes, and today we're going to be simulating a nasogastric tube placement on my patient here. Yeah, don't ask. On my patient here, so today I'll be simulating that. Before we begin, as usual, you enter the room, you wash your hands per CDC guidelines, you introduce yourself to the patient, you tell them what you're going to do, who you are. You verify the patient using two identifiers, ask them to give you their name and date of birth, and you check their bracelet. You ask them if they have any allergies, they say no. Great. So we're gonna, before we actually begin the procedure, we're gonna make sure patient privacy, environmental safety, make sure everything's where it's supposed to be working properly. So now, make sure part working this camera thingy. Okay, so now we're gonna do a GI assessment for the need of a nasogastric placement. So you're gonna be listening for the bowel sounds. Yeah, I don't have a stomach to do that, but you always place these out, you assess. So now you got the information that you need. So now next what we're going to do is we're going to place the patient in the high Fowler's position, which means their head is elevated and it's more, and you move the bed to more comfortable to your height. So it'll be up here. So for me, this would be the patient height and be more comfortable for me. So then we do the patient teaching. Again, we're going to explain the procedure and develop appropriate hand signal for the patient. And this is just for if there's anything that they feel uncomfortable with, because I will be sticking tubes and having them swallow and keeping them busy throughout the time. Really, a hand signal is the easiest thing to do. So now we're going to do a facial assessment. So what you do is you grab your pen light, and what you're going to do is you're going to view up your client's nostrils. You're going to view up your client's nostrils. And then you just have to see. All right. Everything's good. Nothing's in the way that's going to indicate what the procedure. So before we begin, we're going to hand the patient a tissue, and we're going to ask him or her to blow their nose. So now we're good. So now we need to obtain the appropriate equipment for NG2 placement. So let us begin that part. Again, medium-sized gloves, not my size. This is all I have. So we have all of our supplies here. If suction is ordered, you have to verify the suction source type and the time. You have to connect the suction tubing and everything that's there. So we have gathered all of our supplies here for this actual project, and we have it here. So now what we have to do is we have to measure the NG tube, and I have my tape over here. I'm not going to tape it. But you would have your tape, because I'll explain why you need this. So what you're first going to do, let's move this over here. You're going to measure from the nair to the ear. And then you're going to measure from the ear to the xiphoid process. So we're going to bring this around, and actually there's a kink there, so let me fix that before we move forward. Okay, now it's proper. So again, we're going to do from the nair to the ear, and then we're going to keep it in place. So then we're going to move this, and it's going to go to the xiphoid process, which is located in the sternum area. So now we have our placement. And what we're gonna do is we're gonna get a piece of tape it up here, just so we can have, this is our indicator of do not go deeper into that, because that's basically where we want this tube to be. So now we're gonna lubricate 4 inches. Pretend lubricate 4 inches. So now we're gonna ask the patient to slightly flex their head backward, and then gently we're gonna insert the 4 inches. This doesn't require, this is just a clean technique. It doesn't require the sterile gloves. So I forgot to say that. So again, with their head tilt back, it's gonna be hard with one hand. With their head tilt back, we're gonna gently start the insert slightly, and ask the patient tip their. We're gonna first ask the patient to stick their head back. We're gonna gently insert the tube through the left nair. And then when the patient might start to gag, you pull back a little bit slightly until he or she stops. Then once you have it in there, you ask the patient to tip their head forward. And right here you have a good spot. So then this is when you grab your water and you have a straw. And basically every time you ask them to swallow, you are going to advance this tube. So I've actually done this before, and what I actually do is I actually have them swallow, and I say swallow, swallow, and each time they're swallowing, I just advance the tube, advance the tube, advance the tube, advance the tube, advance the tube. So now we have the tube where we want to. We take it away. We do, again, watch for the hand signal. You ask them for patient. You check with comfort. Ask them how they're doing. Any signs of respiratory distress is your big indicator to pull back the tube immediately. Watch for facial grimacing. So now we have the tube here in place. So now we have to secure it there. So usually this wouldn't be, I would have a free hand, so it'd be a lot easier. So we would secure it in place here. Would actually put a piece, there's 2 ways of securing it. The easiest is just doing it on top of there. Again, you have it there, you secure it. You have to be sure this tube is not touching the inside of the nairs. So let's pretend that's your nair. You have to make sure the tube is not touching the skin, because that could cause a breakdown, and you do not want that so close to that area. So when you're putting it in there, you make sure you put that. So when you put the tape, now you gotta check to make sure, where is that? Sorry. So after placement, you need to verify that there is in the distal and it's in the suction, and make sure everything's good. So now you need to make sure that you're in the right area. So what we do over here, we're going to collect a specimen. We're going to aspirate. You pull, aspirate. You're going to have your container. You put it in there. You get your pH sticks, dip it. You make sure it's in the correct area. If it is, you're good. So now you can start getting anything ready. And I did forget to say to gown the person in the beginning. So I did just catch that right now. Gown the person in the beginning before starting any of this to make sure, because there will be water that splashes all over. So now You move everything per CDC guideline. Make sure they're comfortable. Move all the soiled materials. You had just completed that. It's taped up. You make sure he or she is okay. Again, the biggest thing when doing this is watch out to not put the tube right and on the nares right, sitting on top of the skin area. You don't want to cause a breakdown for that. Before you leave, you get all your soiled items. It's taped up. He or she's fine. You throw everything away. Wash your hands. Prior to that, we put the bed down. We put him back to where he's at. We make sure scene safety, everything's safe for the patient. Then we go and we remove our gloves, wash our hands per CDC guidelines, and we make sure everything's good with the patient before we go. And that's how you do it.